the chewable multivitamins, patients ask, what dose of zinc, what dose of this, what dose of that? No. I mean, these are all standardized according to daily requirements. And you look at them, they say 100%, 150%. So your ideal intake should be around 200%. So that's why we always ask you to take double. So 2 chewable multi or 2 capsules of the liquid. The B12 is 1,000 mcg micrograms per week. Now, the absorption of B12 is a little tricky. If you take it by mouth, i.e. if you swallow it, it goes into the gut and it gets absorbed, and things that get absorbed go through the liver, and B12 then gets taken up and doesn't get to the tissues. So if you take B12 by mouth and ingest it, swallow it, you have to take it once a day. If you put it underneath your tongue, where it gets absorbed straight into the bloodstream and doesn't go through the gut and through the liver, it gets taken by the tissues, you can take it once per week. Okay? If you rather do it as an injection through your primary, that's absolutely fine. You have to do it once per month. But no matter what route you decide, you have to take it. And the once per week is probably the easiest. You just remember Sunday or whatever day is your B12 day and you take one per week. Now, some of you find it gives you a little boost of energy and you want to take it more regularly. A couple of times a week is fine, but don't take it every day. It's high dose, it will irritate you in the sense that it will make you very hyper, jittery, and you won't sleep well. So just take it once or twice a week. The calcium, you start at 30 days, and your goal is about 1,000, 1,200 milligrams. That applies across the board, males and females. And calcium comes with vitamin D. Now, there has been some studies recently in the last month or so that have come out and looked at particularly bypass patients after first year. They're finding that they're a little bit more prone to bone density loss. So very important, particularly, you make sure that in order to avoid and prevent osteoporotic changes, to maintain good source of calcium, good source of vitamin D every day. Don't miss it. And the calcium comes in many, many varieties. It comes as chewable, comes as the chewies, which I think are in your packets, comes as powder. Find the one you like. The calcium citrate is better absorbed. The calcium carbonate is not as good absorbed, but you can take it. The citrate is harder to find online. Typically, like Biotic Advantage, you can get it. Carbonate is much more readily available. CVS, Rite Aid, Walmart, Costco, they all have it. If you taking the chewable, look at the dosage. Typically, they're either 400 milligrams, 500, or 600. So aim for 1,200. So you have to take 2 or 3 depending on the actual dosages. If you're taking the chewies, there are 250, 500, or 600. So again, find out. You don't assume, okay, he told me to take 3 calcium, to take 3. You got to find what the dosage individually is. The powders are typically 600. So find what it is and match it up to 1,200. The vitamin D, your goal, ideally maintenance, is somewhere between 1,000 to 2,000 units per day. If you take 3 calciums, each one carries between 400 to 600 units of vitamin D. You will get 12 to 1,800. That's pretty good. But we check your vitamin D levels, and if it's not adequate, we'll always add supplemental vitamin D on top. Iron, if your iron levels are low at the 3 months, we will tell you how much you need to take. And as I said earlier, you don't take calcium and iron together. You have to separate them by about an hour. Okay? So those are the supplementations that you need to take. Biotin for your hair, 1 to 5 milligrams per day. The tablets are 1 milligram. You can take anything between 1 to 5. If you choose the capsules, they are 5. Open the capsule and take the powder.